As the world prepares for COP11 in Geneva, a growing debate within global tobacco control is gaining attention. At the center of this discussion lies the World Health Organization's Framework Convention on Tobacco Control, and a principle many believe is being quietly abandoned: harm reduction. Adopted in 2003, the FCTC was the first international health treaty under the WHO. Article 1D defines tobacco control as a combination of supply, demand, and harm reduction strategies. Yet, unlike other areas of public health, such as HIV prevention or drug use intervention, the harm reduction principle is now largely missing from tobacco policy. Draft decisions under Article 2.1 encourage forward-looking tobacco control measures, but make no mention of harm reduction. Agenda Item 4.5 goes even further, calling harm reduction an industry narrative. This framing ignores independent science and the real-world success of countries that have integrated safer nicotine products into their health strategies. Evidence from several countries tells a consistent story. New Zealand achieved record declines in smoking through regulated access to vaping. Sweden, using snus, has the lowest tobacco-related mortality in Europe, while the UK and Canada also saw accelerated smoking cessation. These outcomes prove harm reduction is not an industry tool, it's a public health success story. Advocates, including the Coalition of Asia-Pacific Tobacco Harm Reduction Advocates, CAFRA, urge parties at COP11 to reaffirm harm reduction as integral to tobacco control. They call for an explicit reference to Article 1D in the final decision text and propose a party-led working group to examine global evidence, regulatory models, and youth protection outcomes. The credibility of the FCTC depends on consistency. Omitting harm reduction from global decisions risks denying millions access to safer alternatives. If the FCTC is to protect public health as intended, COP11 must recognize harm reduction as essential to tobacco control's future.